Welcome to the Nutrition Research Update from the Renaissante Institute of Integrative Medicine. I'm Dr. James Meschino, and our topic today includes autoimmune diseases which affect the joints of the body. These would be conditions like rheumatoid arthritis and ankylosing spondylitis, polymyalgic rheumatica, lupus, Reiter's syndrome, and a whole host of inflammatory joint diseases that are under the autoimmune umbrella. Now, the truth is that autoimmune diseases like this are very difficult for the medical profession to handle. The standard treatment options include anti-inflammatory drugs, like aspirin, ibuprofen, indomethacin, Voltaren. These types of non-steroidal anti-inflammatory drugs come with some problems if you use them regularly, and patients with these autoimmune diseases have to use them on an ongoing basis. And so they can lead to not only stomach irritation, but actual erosion and ulceration in the intestinal tract that can lead to internal bleeding. In fact, 10 to 20,000 people die each year in the United States from internal bleeding linked to those medications. So the least amount that you have to use, the better. And also, these drugs are now linked to liver damage and liver failure, as well as kidney damage and kidney failure. And the truth is that many autoimmune diseases already increase the likelihood of the kidneys failing over time, so the drugs actually just accelerate the process of kidney damage, which is not good news. And some of these drugs have been linked to an increased risk of heart disease and high blood pressure and advancing cartilage erosion in the joints, which makes the joint problems worse. So it's not that these drugs can never be used, but the less you have to rely on them, the better. Other types of drugs that are used for people with autoimmune disease include drugs like Humira and Cimzia. These are what are called TNF inhibitors. And although they do a pretty good job of shutting down how the immune system is attacking the joints, the side effects of those drugs include an increased risk of cancer, an increased risk of serious opportunistic infection, including tuberculosis, and also demyelinating disorders, which can affect the nervous system in a very negative way. So it's not too exciting to have to rely on drugs like that. The less you'd have to rely on them, the better, because of the side effects. And then, of course, when the pain gets really severe, sometimes narcotic pain drugs are used that are morphine or morphine-like drugs, which can create addiction and dependency and put the person into sort of a zombie-like state and also cause liver damage and so on. So none of the drug treatments are really attractive. Now, I understand they need to be used depending on the severity of the case, but I will tell you that what's missing from the management is the powerful influence that diet and supplementation can have. And the reason why it's not typically included is because there are not courses like that that are taught in medical schools, and as part of continuing education for medical doctors, only a few groups actually put on seminars to provide this information to medical doctors, so most MDs never really see it. But there are three really important ways through which supplementation and dietary practices can have a significant impact on improving the long-term management of autoimmune diseases that affect the joints, and these things should be put into place. So these are the three ways that diet and supplementation can help. First of all, they can help to inhibit the synthesis of these inflammatory prostaglandin hormones that produce a lot of local inflammatory reactions that lead to pain and swelling. And also, through diet and supplementation, you can promote the types of local hormones in the joints that actually suppress inflammation. So how does it work? Well, foods and supplements can contain what are called polyunsaturated fats. And unlike other types of fats in the diet, the polyunsaturated fats can actually be converted by your body into hormones that either promote inflammation or suppress inflammation. The hormones are called prostaglandins, and there's three kinds of prostaglandins: prostaglandin series 1, series 2, and series 3. It's prostaglandin series 2 that promotes a lot of inflammation and makes all inflammatory conditions worse, especially autoimmune diseases. Prostaglandin series 2 is made from a really bad fat, polyunsaturated fat, that you find in high-fat meat products and is made worse with high-fat dairy products and overuse of corn oil and sunflower seed oil and other vegetable oils, not all the vegetable oils. But if they have too much of the bad fat, arachidonic acid and linoleic acid to be exact, the body produces these inflammatory prostaglandins called prostaglandin series 2, it makes things much worse. So avoiding those kinds of foods is helpful. At the same time, certain polyunsaturated fats are the raw materials from which the body makes prostaglandin 1 and prostaglandin 3. They have anti-inflammatory effects. So when you have fish or fish oil or flaxseed oil, the body makes prostaglandin series 3. It suppresses inflammation. When you supplement with borage seed oil, your body makes more prostaglandin series 1. You suppress inflammation. So part of the day-to-day strategy for these patients should include a supplement that contains fish, flaxseed, and borage seed oil all in one capsule. I have the patient take 3 to 6 capsules a day. Even drugs like aspirin, that's how they work. They try to block the formation of prostaglandin series 2. That's how important this physiology is. But there are natural herbal agents that also help to directly block the prostaglandin series 2 synthesis, which are really non-toxic. So the herbal agents, curcumin, boswellia, white willow bark extract, and ginger, block the production of the inflammatory prostaglandins, similar to aspirin, but without the toxicity, without the damage to the stomach, and without internal bleeding, and without liver and kidney damage. So I usually have the person take a combination supplement with those 4 herbs, and I have them take somewhere between 3 capsules and 12 capsules a day, depending on the severity. As the person does better, we can decrease the dose down to the lowest possible dose to maintain their improvement. And of course, antioxidants and vitamin B6 as part of a high-potency multivitamin also has anti-inflammatory effects. So number one, you want to try to suppress the inflammatory cascade of what are called prostaglandin hormones. The second way that diet and supplementation can help is by its effect on suppressing the release of these inflammatory cytokines or inflammatory chemicals made by certain white blood cells. So here's what goes haywire in autoimmune disease. This is what really distinguishes it. That a type of white blood cell called the monocyte, which morphs into another white blood cell called the macrophage. Macrophage means large eater. The macrophage in people with autoimmune disease secretes a ton of this cytokine or inflammatory chemical called tumor necrosis factor alpha. We just call it TNF. It's the hallmark feature of most autoimmune diseases. And we don't know why the macrophage and the monocyte behave this way. Some evidence says it gets infected with a virus. It sort of triggers it to behave like this throughout its entire lifespan, and all of its daughter cells do the same. Or there can be genetic reasons for it to behave in this really peculiar way. What we know for sure is that when those white blood cells are secreting all that TNF, the TNF then binds to receptors on other cells of the body, including other white blood cells. They in turn release all kinds of inflammatory cytokines throughout the body, and those inflammatory cytokines then create tons of inflammation. And so the secretion of tumor necrosis factor and the inflammatory cytokines that are sort of result from that are really what makes autoimmune diseases so hard to manage more than other types of inflammatory cases. And so you see that in the synovial tissue, in the wrapping of all the joints, we have this sort of saran wrap around our joints. And in people with rheumatoid arthritis, as an example, when you take a needle and you draw out the fluid, you see tons of monocytes and macrophages secreting all this TNF. It really is a major factor. And that TNF prompts cells to actually secrete other types of proteins that cause the cells to divide faster. And that creates the nodules that you see, the deformities in the hands and the different joints, because the connective tissue is creating all these abnormal nodes and nodules, and they're doing the same thing in the lungs and the same thing in the kidneys. And that's what can lead to the life-threatening consequences of autoimmune disease. And that's how lung damage and kidney damage and joint damage is all tied together in these diseases, because TNF is being secreted and creating havoc throughout the entire body. So in people that have those problems, they usually will give them these drugs like Cimzia and Humira to try to block the effects of TNF. But there are supplements that actually block the release of TNF, and the patient should know this. Supplements like curcumin and quercetin can not only block the secretion of tumor necrosis factor alpha, but can also block the release of inflammatory cytokines within the cell. Curcumin does that, quercetin does that. And vitamin D also encourages the release of a certain cytokine that suppresses inflammation, known as interleukin-4. Patients are often not told that. So by suppressing the release of tumor necrosis factor and the other inflammatory cytokines, that's a second way that diet and supplementation is vitally important in the long-term management. The third way is through what's called immune modulation. That means this: in autoimmune diseases, the immune system is all hopped up and it's overly excitable and it's secreting all these inflammatory cytokines. If there was something that could just pull the immune system back and make it behave in a more normal way, that would be gold. Well, there are no drugs that can do that, but there are supplements that are proven to do that. Certain medicinal mushrooms and astragalus have what's called bioregulation effects, helping to make the immune system behave in a more appropriate way depending upon the circumstances in the body. There was a recent report published in the American Journal of Kidney Disease. A patient had an autoimmune disease of the kidney itself, a very dangerous condition known as membranous nephropathy. And all the drug treatments were failing. The patient went on high doses of the herb astragalus, which is an immune modulator, and it completely reversed the disease and improved kidney function magically. But of course, you need the right dose. So what I've done is I've included a link to that research article so you can see the power of this. The truth is that these supplements are not some casual thing that have some mild effect. If they're used properly, they can have a powerful effect on the long-term management. My problem is that all this evidence is largely ignored by rheumatologists and family doctors, and it's extremely unfortunate. And remember, too, that vitamin D also has immune modulating effects that are powerful. So do probiotics. So do prebiotics with digestive enzymes. When you put all of this together, you get an amazing effect. So the summary is this: that people who have autoimmune diseases affecting their joints need to incorporate the best diet and supplementation practices into the overall treatment program. It leads to better outcomes: less inflammation, more mobility, slower progression of the disease, better quality of life, less internal organ damage. Drugs alone can't do it the same way. Not that drugs aren't needed, but if you can decrease the amount of drug that you need, you're going to decrease the side effects that the drugs are going to induce. And through diet and supplementation and exercise and even chiropractic care in many cases, you can help to decrease the progression of the disease and stabilize it, longer periods of remission, fewer periods of exacerbation. Now, people with autoimmune diseases affecting their joints should also see a chiropractor. Chiropractors can make sure that joints are aligned properly, that they stay more mobile, that you get rid of the muscle contractures that can be a major problem in these types of conditions. And those conditions can lead to, or when the muscles really tighten, it can really lock the joints up. So you get better results, better movement, you get less pain, you preserve joint function and integrity so that you have better quality of movement and quality of health. So, and a chiropractor can also design the appropriate exercise program based on your unique circumstances, how much disability you have, what the degree of pain, the amount of inflammation. So this is what a comprehensive, evidence-based program should look like. It's not just drugs and injections and surgery. Now, in the text below, I outlined the exact nutrition and supplementation program to help improve the management of autoimmune diseases affecting the joints. If you have one of these conditions, I suggest you employ these strategies to the letter. If you know someone that has a problem like this, then please forward this video newsletter to them so they can see the data on this to help themselves. So I hope you found this to be helpful and informative, and thanks for watching. I'll see you next time.